Hi everyone, and today is the most important topic, that is abdominal emergency in pediatric patient coming to oncology ward or in the emergency, or any oncological hemato-oncological patient that came to our ward with severe abdominal pain, fever, loose stool, and that is most commonly called neutropenic entercolitis, because it is the emergency condition in most commonly occurring patient of oncological ward. And so it is one of the important topic to discuss and get awareness. And please subscribe my YouTube channel for get more further information and more knowledge. And let's discuss about the abdominal emergency that commonly occurs in the oncological ward or in the emergency ward, coming to the patient that under the chemotherapy or radiotherapy or stem cell transplant recipient patient that come to our emergency ward. And if any patient that was of previously diagnosed cancer or newly diagnosed cancer or under chemotherapy or without under medication, if the cancer cell infiltrate in the GIT mucosa, it may cause perforation of GIT mucosa or necrosis or severe boil wall infarction that leads to severe abdominal pain and fever, and that leads to loose stools which and the patient presentation occurs in the form of fever, loose stool, severe abdominal pain, and severe episodes of vomiting, which may not relieve on medication or eating ORS. So the oncological emergency, that is also called typhlitis or necrotizing colitis, most commonly limited to the ileum and cecum of our GIT. And for the diagnosis of such abdominal emergency like neutropenic enterocolitis, there may be infection in the lab, like increased leukocyte count or neutrophil, decrease in neutrophil, that is neutropenic. So the diagnosis is neutropenic enterocolitis. Neutrophil may be low, ANC may less than 500 or less than 1000 may be present with clinical finding. And if we do USG of the abdomen, there is diffuse thickening of the bowel wall, and CT there is diffuse thickening of the cecal wall, and also there is also free air in the peritoneum if we do X-ray of such patient. And so after making the laboratory investigation and USG, CT scan or X-ray of the abdomen, if there is thickening of the bowel wall or necrosis or perforation or gas in the diaphragm is seen, then we have to suspect this case as the cancer cells are invaded to the GIT mucosa, leading to neutropenic enterocolitis. And such patients are admitted in the PICU without giving any fluid. Oral intake should be stopped and should put in NPO, and IV fluid should be given to and vitals should be monitored regularly, and we have to do gastric decompression and correct other electrolyte imbalance if there is present, like sodium, potassium, or if there is hypoglycemia, we have to correct hypoglycemia. If there is hyponatremia, we have to correct hyponatremia, and also we have to provide broad spectrum antibiotics, tazapib, to cover both gram positive and gram negative organism, because the causative agent may be gram positive and gram negative in such case. And in gram negative there may be Pseudomonas, E. coli, Clostridium, and in gram positive there will be Staphylococcus, Streptococcus, Enterococcus. And so after admitting in the PICU and giving such medication, we can correct such abdominal emergency, and we have to for further evaluation we have to do consult our oncological team. After describing this, I am going to stop this topic. Thank you.